Hi, there's nothing worse, especially during this COVID and season. There's nothing worse than having our loved one be hospitalized, especially since we cannot be there. Hi, I'm Aileen Reese, a geriatric care manager. I'm from Caregivers Assist Support Group. It's our Facebook group. If you need additional support, please meet us over there. But today we're going to be talking about how we can keep track of the care of our loved ones while they are being hospitalized. So, if our loved one is in the emergency room and they have to be admitted to the hospital, you need to find out if you need a code to keep track of their care. So sometimes it's a 5-digit code. So when you call in to the hospital, they will share information with you. If you are the health surrogate and the health power of attorney, you may want to fax over that paperwork so that it can be in the file, so there will be no problems with communicating with you about their care. And if you do not have a health power of attorney or health surrogate set up for you and your loved ones, you need to do it, and you need to have it on hand so you can get the information you need when you need it. So the first thing you want to do when your loved one gets admitted is to get them to write your phone number on the board. Every hospital room has a whiteboard, and you want to get someone to write your phone number on the whiteboard with instructions. When doctor visits, call me, and put your phone number very large on the board. Hopefully, your loved one, when the doctor comes in, will say, let's call my house and let's make sure my husband or wife is in on this consultation. So hopefully that happens. If all of that fails, you need to um, the problem is if your loved one forgets or they have cognitive impairments that they cannot remember to call you when the doctor comes in. We all know that those visits are quick, but if there's any way you can talk to the doctor while they're in there with your loved one, that is the ideal time. And like when your loved one is in the emergency room in the previous video that I did, the advice was to follow the doctor's orders. So when you call in and want updates, you want to ask, are there any more doctor's orders? And what are the results from the previous orders that have already been assigned? So if all else fails, then you rely on the nurses and the RNs assigned to your loved one. And at every shift, there will be a nurse assigned to your loved one that will be distributing the meds. They will be coming and checking on your loved one, hopefully at least every 2 hours. And that is who you may have to rely on to get most of your information. So the first thing you have to do is find out the best way to talk to them. And you find out, are they on a 12-hour shift? Are they from 7 a.m. to 7 p.m.? Or they might be on a 8-hour shifts, 3 8-hour shifts that are 7 to 3, 3 to 11, and then 11 to 7. So if the nurses are on a 7 a.m. to 7 p.m. shift, they come in at 7 o'clock, they get they do their shift change communication, they distribute meds, and the doctors usually do their rounds, sometimes first thing in the morning. So the best time to talk to them is mid-shift. You can't wait until the end of the shift. You can't call them probably after 6. By 6, they are trying to get everything wrapped up for the next shift. So you need to find somewhere in between. Somewhere maybe between noon and 2 might be a good time to call. Maybe if the patients are eating lunch, and then you have to work around their lunch schedule. But something around 2, they should be able to give you some information. And then you can keep trying them until usually about 5. So your window to get good information from them is going to be from like noon till 5. And then you have the 7 p.m. to 7 a.m. nurse. And I have set my alarm at 2 a.m., 3 a.m., 4 a.m. to call them. And often they have more time that they're able to spend with you as far as what orders have been completed, what are the results, and what orders are you still waiting to be completed. But everything in a hospital runs on the doctor's orders, and the care for your loved one is dictated by the test results from the orders that the doctors are ordering and the specialists that are coming by to see them. Now we know, and then the 7 to 3 shifts are the same. Try to get them, between 11 and 2 or 11 and 3 are the best times to talk to the nurses on the 8-hour shifts. Try to get them in the middle of the shift. So you know that in the hospital these days, our GPs are usually not in there. Our loved ones are being seen by doctors they may or may not know. And there are also hospitalists that will be assigned to your loved one. And they are also, you want to make sure you get their name because they are going to be tracing your loved one's care. And they are all likely the ones that will be calling you and letting you know when your loved one will be discharged. So the hospitalists, it's important to get their name. And there might be, hopefully you'll get the same one several days. Often they change every day. But that's their, since your loved ones do not see their GP, they will be seeing a hospitalist. And the goal in the hospitals these days are different than they used to be. The goal these days is to get your loved one stabilized and discharged. Unfortunately, the goal to find a diagnosis, we all want a diagnosis, and that is what your goal is, to be talking and finding out, can they get a diagnosis through all the testing that they're going to do. But that is not their goal. Their goal is to get your loved one stabilized so they can go back to their GP, their doctor. And that will be in your discharge instructions, to go within 2 weeks to go back to see their general practitioner or their doctor. So when you do get the call that your loved one is being discharged, hopefully you will ask them and they will have some diagnosis. But like I say, there may or may not be a diagnosis to find out what happened to them or what put them in the hospital in the first place. But the first thing you do want to ask is, are all the doctor's orders complete? I've been called before and told that a loved one of mine is being discharged, and I've asked them, did the chest x-ray get done, or what are the results of one of the orders that had been placed, and they did not have the results yet. So you want to make sure that your loved one does not get discharged before all the doctor's testing and the doctor's orders have been done. And that's very important, because my loved one, I think they were in for at least another day or so until all the testing was finished. So sometimes they get ahead of themselves, and there is a push to discharge before it's necessary or before they should. So that is one way to track and make sure if your loved one is ready for discharge. Make sure all their testing has been done at least. And also you want to make sure that your loved one has another person that you may need to talk to is the discharge planner. and your loved one will be assigned a discharge planner in the hospital. And you want to talk to them about all the options for your loved one. If you don't, if your loved one cannot get from the bed to the bathroom by themselves, then they may not be able to come home. That is the big criteria whether someone can come home or not. If they cannot get from the bedroom to the bathroom by themselves, they may need to go to rehab. And you would want to talk to the discharge planner about your options for rehab in your area. And some rehabs are better than others. And if you do find out your loved one does need a rehab, you may want to start calling the rehabs closest to you. You may want to start talking to friends and neighbors that have been to rehabs and find the best one for your loved one. So I hope those tips will help you, and I hope you will give comments to us for any tips or any things that may have worked for you when your loved one was hospitalized. Please let us know your experiences, and hope to see you in our Facebook group, Caregivers Assist.